Okay, so let's talk about St. John's wort. Now, this is also a case study in misinformation. My guess is if you go out and you call up 10 psychiatrists, you're going to hear 9 or 10 of them say, well, St. John's wort might be useful for mild depressions but not major depression. I'll bet you $10. I'll bet you your $15 that you owe me. Okay, there's some of you. Anyway. And you know why? It's because there was this really huge study that came out about 6 years ago. Duke University, okay, it made the nightly news. So St. John's wort been shown in this large study at Duke University to be no more effective than placebo. And it really made an impression, okay? What they didn't say in that same study is there was a third drug that was also used, which was Zoloft, which also was no better than placebo. Oh, that's interesting. Okay, now if you look at any medical treatment, you're going to find some negative studies. We all know this, okay, and you can find some positive, and that's why meta-analyses are the way to go, because you collapse the data. The St. John's wort works if you use it the right way, okay? Cochrane database, again, the most reliable source for getting good information, meta-analyses, and that sort of thing, okay? St. John's wort, equally effective prescription antidepressants, and this is for treating major depression, okay? For major depression, but you have to use really high doses. St. John's wort is the top-selling antidepressant in Germany. In Germany, you can buy St. John's wort over the counter, but because they have socialized medicine, if you get a prescription for it, you get it for free. And you know why they do that? Because and that's a good thing to do, because you don't want bipolar people without supervision of a physician or therapist taking St. John's wort, because it can flip them into a mania. So it encourages people to use this under medical supervision, and that's really the way that it should be. Okay, so let's look at some details. Why would you use St. John's wort? Well, number one, it's got virtually no side effects. Can any, pharmaceutical antidepressant say that? Nope. You have to, some people, for whatever reason, they're going to say, I'm not taking any drugs. I want to do it the natural way. So what do we say? Oh, well, too bad. No, there are options, okay? So that's another reason, all right? Now, the dose that it usually takes to treat severe depression is 1,800 milligrams a day. Now, this is not without problems. First off, if you take 1,800 milligrams all at once, you'll probably throw up. It causes a lot of nausea. It may cause vomiting. You have to take it in 3 divided doses, 600 milligrams 3 times a day. And as I said before, especially with depression, it's very common that people forget to take a dose or two. So the research is based on people that actually are taking these high doses. Okay, and that's a big deal. Another reason, it's pretty inexpensive. Side effects, the GI effects, usually if you eat it with food and split the dose, it's not a problem. Can cause some sedation. But no weight gain, no sexual dysfunction. The biggest problem with St. John's wort are drug-drug interactions. And St. John's wort has 32 different bioactive molecules. I mean, it's not just one, compound. It's just a whole bunch of different stuff mixed in there to have a whole bunch of different effects on liver functioning. In fact, it increases some liver enzymes. It inhibits some liver enzymes. So taken by itself, it's no problem at all. It's well tolerated. But the big problem is if you mix it with certain drugs. And probably the most infamous example of this is mixing it with birth control pills, because it induces enzyme activity that reduces birth control blood levels, and people get pregnant. And they think they had something to be depressed about before. Okay, but there have been some fatalities, and so it's people say, I mean, if you're going to remember, 1 or 2 things from today, it's like natural doesn't necessarily mean safe. Okay. And so the number of drugs that potentially are problematic is more than anybody can memorize. And the way to go is to go, you can look at the website, the algorithm, or go to a pharmacist. And your patients can go, and if they want to try St. John's wort, say, hey, I'm taking this drug and this drug, is there any problem? They'll get on their computer database and say, no, it's okay, you can take it. Okay? But you can get in a lot of trouble if you recommend people take this without consulting their pharmacist or their physician. Okay? You don't want to use this along with other antidepressants because it can, at least theoretically, cause serotonin syndrome, which I'll talk about later on. It takes 5 days for St. John's wort to wash out, to be completely excreted. So if somebody takes St. John's wort and says, well, this isn't working, my doctor says I should take Effexor, then they need to not take the antidepressant for 5 days, and then they can start it. Okay?
Does it still take like 4 to 6 weeks to take that?
Yeah. It takes some studies show it takes a little bit longer than some of the antidepressants, more like 6 to 8 weeks, but the outcome is similar.